Have we got most people in? Okay. Then I will begin. So if you do have any questions as we go through today, please do put them in the chat bar. We would ask you all to keep muted. There's over 80 people in the room. So I'm sure your private lives are very fascinating, but you probably don't want them broadcast across Dorset. So yes, please keep yourself muted. If you do have any questions, put them in the chat bar as we go. Joe will keep an eye on the chat bar and as much as possible answer any questions. If there are any unanswered questions, we'll pick those up at the end and they will be posted with all the resources on our webinar page so that you can come back to them later, as will all the resources from today and these slides. So this first slide has got a link to the guidance, which is updated fairly regularly by the government, and also to the legislation. If you are in charge of a building, it is worth having a look at the legislation. Do you want to put aside a little bit of time to go through it? If you've gone through the guidance first, the legislation makes a lot more sense. The legislation is a lot broader than it has been in previous times. So that has left some dispute around which we follow, the guidance or the legislation. Our rule of thumb is always the most restrictive, whether it's the legislation or the guidance should be the one you follow. That way you won't fall foul of the law. So all of the steps that are laid out in the government roadmap are limited by these 4 tests. So all of the dates that have been given could change at any time if any of those 4 tests are not met. So if we start to see new variants coming in that increase the risk to people, then there may be some delay in the dates. If we see a surge in hospital admissions or the dying numbers go up, or there's some kind of halt on the vaccine program, any of those things could lead to these dates being changed. The government have very wisely put a 5-week gap in between each of the dates, which allows for 4 weeks data gathering, and that allows for 1 week's notice. So before we move into the next step on the 17th of May, a week before that at the very latest, the government should be saying whether that's the date that everything goes ahead and whether there's any change to the legislation or to the guidance. As you can see by my handy little ticks, we've already managed to navigate our way through step 1, part 1 and B, and we've entered into step 2, which I think is really good and gives every reason to be optimistic, if not just slightly cautious. I've left up the details around step 1 just because I think it's useful to have them all together. I'm not going to go through them now, apart from to highlight on the 6th of April, they clarified the situation around what they meant by a child. So a child is anyone who's under 18 on the 31st of August 2020. So that's their clarification around 18. Around what children means as far as the legislation and the guidance goes. So step 2, 12th of April, this is where we are now. Now, although community buildings are part of the open up strategy, it is worth mentioning that social activity is still not permitted. So for a large number of community buildings, village halls, that is going to have a big limit on the activities that you would be able to carry out. And I know many of you have taken the ACRE guidance and kept the 17th of May as your opening date. If you are opening on the 12th of April, it's just being really sure you're very clear on the guidance. One potential area of new business is the fact that funerals funerals and weddings have now upped the number of guests that can attend for wakes and for celebrations. And as the hospitality industry still isn't open, then people may well be contacting village halls and community buildings to see if they can have receptions in your building. It's an area to consider. It doesn't need to mean you fully open. You can open for a specific event only, but you would need to make sure that you've got all of the guidance in place in order to do that in a COVID secure way. And that will be completely down to each individual village hall, community building committee, trustee board to make that decision. All indoor children's activities can open, which I think is quite a significant one. So these are things that previously weren't allowed under the children's activities that could be open, remembering that age range when we say children. Parent and child groups can open indoors now. And remember that children under 5 aren't counted in your numbers. So if a parent is bringing an older child and they've got baby on their hip, the baby on the hip isn't going to be counted as part of your numbers. Good news for charity shops, they can open, and I know in my local town of Blandford that it was really lovely to see some of those opening. I'm quite excited myself of going for a little bit of a rummage. I've got a feeling there's going to be some real gems out there, as we've all been hoarding for the last few weeks, unable to take them to charity shops. So yeah, I'm looking forward to that bargain hunting. And of course, other non-essential retail is open. I won't be so quick to get to the hairdressers. I think I've got used now to the grey. Outdoor gathering and events. Now, we mentioned this at our last webinar. So these are permitted, and that includes things like village fetes, for example. But the guidance hadn't come out at that point, and it has come out now. And the link is actually down here at the bottom so that you can get specific guidance. And it is very clear. You could only have something like a village fete if you were able to show that the entrance and egress were really separate, that there was a stream and a flow that would run through that outdoor event, and there was no chance of mingling or gathering. So if you had a show, for example, then actually that wouldn't be permitted, because people would stop and congregate in order to watch the show. So there has to be a thoroughfare that runs through the event in order to keep people moving and make sure that there isn't gathering of those separate groups. You'd also have to have some kind of entrance that was checking to make sure that only 2 households or groups of 6 were entering. And that would be an expectation, I think, that you were doing some kind of check. If people were fraudulently coming in smaller groups, then going into the event and starting to mingle, that becomes their liability. But you would need to demonstrate something to show that you were putting things in place. I don't foresee a lot of events going on, I have to be honest, in this next 5 weeks. I think most of them will wait until restrictions are lifted further at the next step. But it is worth being aware that the guidance is now out. So just a little bit more on that social contact. It is really important to remember that nothing has changed around the social contact rules. So that means 2 meters apart or 1 meter with mitigation. And that mitigation could be masks, it could be perspex screens, anything like that at all that mitigates the risk so that you can be closer together. But that rule is still in place. Now, it's frequently not mentioned in the guidance, and it's also frequently not mentioned in the media. They start to talk about groups of 6 being able to mix. Well, actually, we need to be very aware that it's still within social contact rules. And then there's clarification which came from ACRE, linked directly to the guidance on reopening, that clarifies that we mustn't be doing anything that brings people together. So that social activity would need to wait. The latest guidance rules around step 2, so specific to step 2, are down here at the bottom. So if you wanted to refresh yourself just on the restrictions around this particular step, that's the link that you would use. So step 3, I think the one that probably that most of us are looking forward to is on the 17th of May. That's the earliest that will take place. And it means that we can have indoor events. 50% capacity is a good rule of thumb. I think it is something like 1,000 people or 50%, whichever is the lowest. So 50% is a good rule of thumb to be using when you're looking at capacity for your venues. There are particular rules around outdoor activities and capacity, and depending on the size of your venue. And again, the guidance that I pointed to earlier goes into that in greater depth. But for most outdoor entertainment events, the 50% is still a very good rule of thumb. We know that hospitality settings will be able to open, and we will get back to having films, shows, plays, concerts, and sports matches, although there are going to be severe restrictions, as I say, around capacity. Up to 30 people for weddings, receptions, funerals, and christenings, slightly different, and bar mitzvahs will be allowed at this stage. The rule of 6 will be abolished and will be replaced with a limit of 30 people. How it will work with families and friends, we still don't know. And I would expect that guidance to come out much closer to the 17th of May, probably close to that week before. So that's more the family and friends, kind of how that will work and whether there will be any social contact, distance or mitigating things that we'll need to keep in place when we're around families and friends. We won't know about that fully until much closer to the date. Remember when we're talking about this that there is 5 weeks of monitoring that's going to be taking place from now. So there is going to be a lot that's dependent upon how people deal with the easing that we're seeing at step 2 and how compliant people are in keeping the social contact rules going. And it will be dependent upon those 4 tests. So if new variants come in, if they affect the infection rates, if we see an increase in hospital admissions, then all of that will have an impact. If the vaccine rate starts to slow down for any reason, because perhaps of reluctance of younger people to take the vaccination, that could have an impact on the delay. If we see the impact of the vaccinations not being quite what we hope, and we see deaths and dying rates going back up or people going into ICU, then again, that could have an impact. So this next 4 weeks of monitoring is going to be very important when assessing whether we move on to the step 3 at the 17th of May. And that's why it's so beholden upon us to stick to the rules within step 2 and not to stretch that, because all we do is actually run the risk of delaying that 17th of May start date. It's worth mentioning that guidance came out yesterday that university students will go back on the 17th of May. I'm probably going to hear more about that over the next few days, because for many students, universities, all of their lectures and exams will have finished by then. So that's creating some consternation, but I don't see that changing. And of course, part of the thinking behind that is not to bring in too many variables during the next 4 weeks in order to monitor the impact of the easing of restrictions at step 2. So step 4 is when we hope that all limits on social contact will be removed. We will need to wait and see. Very little guidance is actually around for the 21st of June. So at the moment, all we know is that the aspiration is to lift as many restrictions as possible. But it's really, really important that we don't think everything goes back to normal on the 21st of June. We have to display caution. So that means carrying on with our good hand hygiene that we've been using, covering our faces when we're in large crowds, and keeping as much space between us and people that we don't live with or aren't part of our support bubble. Fresh air is going to be really key. And I think as we move into the summer, this is going to be the new emphasis that we're going to be putting on, keeping windows open, keeping a good flow of ventilation in buildings. And as we move forward, these are probably good standards that maybe we might take with us. Better hand hygiene can only be a good thing. We've all seen the horror stories of that bowl of peanuts that are put on a bar and then they're tested for bacteria later. Yeah, we know hand hygiene isn't particularly brilliant in this country. So if we can maybe take a little bit of that with us on our road out of COVID, that would be fantastic. So it's taking some of that those lessons that we've learned that are really good and they're good benefit for the rest of society. Even as we come up to the next winter time, I think there might be some talk about reintroduction of masks in communal areas as a way of actually mitigating against further COVID, or possibly even reducing some of the numbers of people that become seriously ill with flu. So I don't think these things will disappear overnight on the 21st of June, even if all of the indicators are good. But what we should see is a return to something which feels much more like normality. So for those of you that are looking at reopening now or are looking at reopening on the 17th of May, just a few little handy hints. Be cautious. We all want to be optimistic and aspirational, and that's fantastic. And that's what makes our sector so wonderful to work within. But we need a note of caution. Be ready for delays if they should happen. So if the 17th of May gets moved, that you've got things built in, that you've already preempted customers and they know that that date could change, that if you've made bookings very close to that 17th of May, that the people that have booked know that it will be based upon the government guidance. Go over your risk assessments, have a look at those health and safety requirements. If you've been closed for a long time, there's lots of things you're going to need to look at to make sure they're as up to date as possible. And now is the time to be claiming for funding for things like PPE. There are still small pots of money out there to help with that. And it's good to make the most of it. We have got training, as I think I've mentioned already, on the 21st of April, and Jo will talk about that a little bit more. So we have put some special training on to support with that reopening agenda. And we have a special 50% discount for members, so a little plug for our membership there. Test, trace and isolate, again, isn't going away anytime soon, so that will still need to be in your booking systems. And check your capacity limits. Make sure you know, if we're talking about 50% capacity, well, what does that mean for your particular business? There is lots of resources available on our website. Do go back and revisit previous reopening guidance, because actually we're reopening in a very similar way, although the steps are different. All of the guidance around health and safety, risk assessments, preventative measures, mitigating factors, all of those are still the same, so they're still really useful. The ACRE guidance is also on our website, and all the links are there in blue, and when you open up the slides, you'll just be able to access everything straight from the links. And also the Health and Safety Executive have put their latest guidance refreshed up, and that's the link to that guidance. So a little bit on some of the new things that are going on, and the first one is probably to do with testing and vaccinations. So we are now able, all of us, to do the rapid flow testing. So this is something we can do. We don't need to have symptoms, and it's probably something we should all consider doing regularly as a good way for both the government to keep an eye on numbers of people that might have infections, but also for all of us to be aware of our risk, and as things open up, make sure that we are isolating as we need to. Little prompts there that if you are an employer or you have volunteers, you can register in order to get your employees and volunteers tested. So how do you go about getting the tests? Well, you can go to a test site, that's fairly straightforward, or you can get them to do at home, and you can collect up to 2 packs of 7 tests from your local pharmacy or test site. If you do them yourself at home, you do need to register them, and all the details are on the kit of how to do that, but you do need to actually be able to do that. And I've just realized I missed something on my previous slide. I'm just going to go back. Sorry, the little bit down here at the bottom here, this email address for Public Health Dorset comms. If you would like any of the information around testing in another language, that's where to go. Email them and they can provide you with that. There's also videos and other resources to help people with other languages other than English. So they don't need to be non-English speaking, but if English is not their first language, they probably would benefit from that. So getting vaccinated, we've now opened up vaccinations to 45 to 49-year-olds. Now everybody, that means everybody in the cohorts 1 to 9 have been offered a vaccine. If you fall into those categories 1 to 9, i.e. you're over the age of 50, or you have significant health problems. Oh, I think somebody may not be on mute. Oh, lovely, thank you. Or you have significant health problems and you haven't been offered a vaccine, then do go to the NHS booking service in order to be able to book yourself in and to ask the question. Don't keep waiting to hear from somebody. People do get missed. If you are aged 45 to 49, you can go onto the NHS booking service in order to book yourself in. The final advice on phase 2 of the vaccination, so that's after the 1 to 9 cohorts, has now been released and it's been accepted by the government, so that's now in place. And what that means is that we will begin to roll the vaccines out based purely on age, and that will continue to roll out as we move through new stages. All of the information in other languages is available via our Dorset CCG, which is the link at the bottom here. And it's really good. The resources that Dorset CCG have put together are really fantastic and really, really accessible. They've also got easy read versions on there too. And I would recommend sharing that as widely as possible to make sure as many people of our community know that there are other versions of the vaccination guidance out there. If we don't support people where English isn't their first language, or where they may have a learning disability, or they may have some literacy issues, what we allow is misinformation to fester, because people will go to other sites in order to get that information. So just a quick little bit about support available. There's 2 really good resources around suicide prevention and mental health training, and the links are here. Really, really good training. I'm probably just quickly going to mention about the support packages for businesses. So there will be an ARG payment for the 11 days from the 1st of April to the 11th of April. It's not anticipated there will be any eligibility after that, because the government guidance states that community buildings can open on the 12th of April. So I wouldn't imagine anything from then onwards. But then again, I pessimistically said there wouldn't be anything after the end of March. So what do I know? So from the 1st to the 11th of April, there will be a payment. If you've already received payments under this scheme, so the business support scheme, you will receive that automatically. There isn't anything you have to do. If you haven't received money and you have a rateable business, do register your business in order to be eligible for the previous payment. You won't be able to get further back than that, but you will be eligible for that. And that opens on the week beginning of the 19th of April, so next week. So as I say, you don't need to apply if you've previously received. And there's a little mention there about other support that we know about, so the furlough scheme, for example. The new COVID restart grant for businesses, the further details have come out about that. And we can see within leisure, village halls, scout huts, cadet huts, so similar to the previous scheme, are included within this. So it is worth finding out more about it. It was done through the council in the same way as before. If you received a local restriction support grant, then you will automatically receive money via this scheme. You don't need to apply. If you didn't receive it, and we haven't had clarification yet of whether the ARG, so the additional restriction grant, we don't know whether it includes that one yet. But if you think you're an eligible business, and you can go onto the eligible business checker to see if you are a rateable business that is included, and remember it includes retail, then you will need to apply. That's not available yet. They must be submitted by the 30th of June, and the information about applying will be on this link here. I personally, if you previously received a grant, I would wait and see if you receive the money automatically. If you don't, when it goes live, and you'll be able to check here, if you don't receive the money automatically, then it's probably worth going back and checking whether you need to apply. All of the information will be on this website here. So it's worth keeping that as a live link so that you can go back and check. And on the slides as well will just be links to those local support groups so that you can get further help. And just a reminder that that hands, face space hasn't gone away. And remember, fresh air, really important. Okay, I'm going to stop sharing. So thank you for bearing with me. It's quite a lot to get through, but you do have all of the slides as a means of reference to come back to. So without further ado, I'm going to hand over to Vikki Andrews and to Keith Withers to introduce themselves and to introduce their amazing project. So over to you, Vikki.
Good morning, everyone. Thank you to Paula and the team for inviting us this morning. So my name's Vikki Andrews. I'm part of the Dorset Macmillan Cancer Information Project. Do you have the first slide, Rachel? So we're in the final year of a 3-year project, which has been funded by Macmillan. We're part of Dorset Cancer Partnership, which is part of Dorset CCG. I'm also joined this morning, but I've got various colleagues here in the meeting, but by my colleague Keith, who's also going to be presenting shortly. So next slide, please. So the aim of this project is to ensure that cancer patients, families, carers are able to access information and support in the right place, at the right time, and in the right way to suit them. So just before I get a bit more into the detail, I wonder if we could ask you a couple of questions. And I think, Rachel, you've got a poll for us. And I think the first question is, how many people do you think will get cancer in their lifetime? So is it 1 in 2, 1 in 3, or 1 in 4? And the second question is, how many people are estimated to be living with and beyond cancer in Dorset in 2020. Okay, it's good to see how the polls are moving up and down as people are submitting their answers. So I think this is just going to give us a measure of, you know, the situation with cancer as we find it, both nationally, and then I'll give you some more local Dorset information in a little while. Okay, so well, you're obviously a very well-informed bunch, because it is, in fact, if you move to the next slide, Rachel, 1 in 2 people will experience cancer in their lifetime, and indeed it is 34,500 people in Dorset in 2020 who are living with and beyond cancer. So that's quite a sizable number. And the other information that we do know is that there's just over 5,000 people diagnosed with cancer in Dorset each year, which equates to about 15 to 16 people a day who are receiving this life-changing news. So that's really quite significant. So if we move to the next slide, please. So as part of this project, we've developed a new website, and that's for people who are living with or worried about cancer who live in the Wessex region. And that, as most of you will know, includes Dorset, Hampshire and the Isle of Wight. This website's called Cancer Matters Wessex. We were hoping to be out in the community and meeting as many of you and other people as possible to highlight how we can signpost people to high quality relevant information, as well as the local information and support which people are finding so important, and particularly in the last year. But due to the restrictions of COVID, this hasn't been possible. So instead, we've been holding free cancer information and support virtual webinars. These have been really well received, and so far they've been very well received so far. And we've got 2 more sessions planned in the coming weeks, which we want to highlight to you all. So Keith, if I can ask you on the next slide, Rachel, if you could take over the screen and give everyone a flavour of what you can find on the website.
Yes, indeed. Good morning, everyone. Good afternoon, everyone, even. Hopefully you can now see the Cancer Matters Wessex homepage. If someone could give me a thumbs up or a yes, that would be very welcome. Fantastic, thank you very much. So yeah, as Vikki said, my name's Keith. I'm working full-time on the Cancer Matters Wessex project, and I suppose the first thing to say, if, like me, you didn't know what Wessex meant, it is Dorset, Hampshire and the Isle of Wight, 3 separate healthcare systems who famously agree on absolutely everything and are very much joined up. So the first thing to say is, who is the website for? And principally it's for people who are affected by cancer, whether that's they've had a diagnosis themselves, for family members, friends, carers, but also for volunteers and healthcare professionals, healthcare workers who meet people affected by cancer in their day-to-day roles. It's also available and useful for anyone who's interested in finding out more about cancer or living more healthily. And I'll show you a little bit later on. At its heart, this is a signposting website, so it contains lots of links to other sites and services, and we've made a partnership with a national searchable directory called the Cancer Care Map, which is a resource where you can type in your postcode and you can look for local cancer support groups and other useful resources. So I'm going to show you a couple of examples. So, for example, if you've had a cancer diagnosis and you want to find out what might be about to happen, you can click on one of the cancer pathways, and within the cancer pathway you can find out who you might meet along the way, what treatment options might be available to you, and the side effects and anything else you need to know about those treatment options. And there's also information about living with and beyond cancer. And we've set this out in a friendly, readable way, and as I say, with lots of links to other resources if you want to find out more information. If you are a carer for someone who has had a cancer diagnosis or has had a fast-track referral to a hospital for more diagnostic tests, there is information in here about diagnostic appointments, fast-track referrals, and it's available in several languages and even a British Sign Language video. If you need information in any other formats, of course, you can contact us. And finally, a member of the public looking for information about keeping well, there's a page here with some information about cancer prevention, tips for good health, and then links to resources to do with healthy eating, physical activity, stopping smoking. So all those, the main risk factors of cancer. The last thing to say is that the website is still under development. I'm still working on it. And if you are on here and you have any questions about anything at all, we have a contact us form, which is essentially a contact me form. And I'm happy for anyone to use this about any questions they have, because if nothing else, it'll help us to find out what people don't know and to help us fill in the gaps of people's cancer knowledge. Right, that's it from me. Thank you very much indeed for letting me talk to you today, and I'll stop sharing.
That's brilliant. Thanks so much, Keith. So we can move on to the next slide, please. So, so what can you do? Well, if you attend one of our webinars, you can find out more about cancer, how to use the website effectively, meet some of the healthcare professionals who join us at these sessions, and find out more about what Macmillan Cancer Support can do. Next slide, please. So just for those of you who would be interested, there's the free phone telephone number and website address for Macmillan. But if you come to one of our webinars, we can explain the richness of information and support and the various ways that they offer that. Next slide, please. So please come to one of our webinars. So we've got one in a couple of weeks' time. They're both over a lunchtime session between 1 and 2:30. So we've got the 28th of April and the 12th of May. There is a link here to register your interest. And I'm hoping that in the chat, JC may be putting the link to the form as well. You can email us, the email address below, or visit the website. I'm hoping that Keith will be able to put a news item, if you look in the news section on the website, with a link to the form to register for one of those sessions. That's it from me. It's been really great to have the opportunity to talk to you all. If anyone's got any comments or questions, we'd be glad to hear them.
That's lovely. Thank you, Vikki. And if there are any questions, please just put them into the chat bar. As I say, we'll do our best to answer them as we go today. But any that aren't answered will be answered after today's session. And we will forward, Vikki, to you any questions that come up in the chat. Thank you so much for that. Please do make use of the resource. Vikki and some of her team will be attending our networking event on the 28th, and there'll be an opportunity there to sort of be a bit more interactive. So if you do have any questions for Vikki or her team, do come along on the 28th, and there'll be another opportunity and probably hopefully a bit more into interaction, because the group will be a little bit smaller than today. I'm going to hand over to Jo now, who's going to talk you through some things to remember around risk assessments as we move into that phase of reopening. So thank you, Jo.
Dreaded mute button. Hopefully Ray has got my slides to be able to, oh, here we go. Right, before I go into the parts that I was going to go on to about risk assessments, I just also wanted to talk to you about the Trusted Voices Champions. I don't know how many people have heard about these, but Trusted Voices Champions is a project that's being run by Public Health Dorset, Bournemouth CAN, who are our sister organisation in Bournemouth, Poole and Christchurch, and of course ourselves, Dorset Community Action, and you can see the Trusted Voices logo there. And it's been set up because we realised that not everybody was getting the right information about COVID, with things like social distancing, how to get the tests to find out if they had COVID, to understand what social distancing and self-isolating meant, and how they could get their injection, for example, if they weren't registered with a GP, and sort of also dispelling all those myths that are out there, such as if you have the jab, you're going to be injected with a microchip, and all the other rumours that you've probably heard. And we all know that we do listen to our friends and family and our local neighbours because we trust them, we know them. So what we wanted to do was to create a network of trusted voices that would be community members. So it would be an established community leader that you might know. It might be someone that you love and respect in a workplace or voluntary setting, or it might be a representative of a given community. So for example, we've base with people in Jewish communities, Muslim communities, settled travellers, all sorts of different communities. And the big thing is to get the right message out there, because we want to prevent, identify and control any local outbreaks of coronavirus. And this is really important now, particularly as we're starting to come back out of the lockdown. More than ever, this is really, really important. Can I have the next slide, please? So how does this work? Well, Public Health Dorset, Dorset Community Action and CAN will work with you as a trusted voice. So we would send you the right information to give out, so that if someone said to you, oh, I believe that having the jab is going to turn you pink, blue and sort of with yellow spots, you'll be able to say to them, well, actually, no, it's not. And this is why. So you would be given good, factual, clear information. And if you wanted the information in a different language or a different format, we can deliver that too. So whether it be sign language, or if you wanted it in larger print or braille, we can do all of that. So if you want to sign up to be a trusted voice, there are two ways that you can have a look. One is the Public Health Dorset page, and there's a newsletter that you can sign up to on that one. And we've also got a Facebook page there as well. And of course, these links you will see when they're posted on our website later on. So now going back to my original part of this. So this is what I'm going to be doing next Wednesday. And we're looking at reopening halls, classes and businesses. And I've divided them like that because we get asked so many different questions that relate to all of these three. So it might be that you run an activity to do with quilting, or it might be that you run yoga classes or Zumba classes. So the class section is kind of anything to do with any form of group that's going to be meeting. Then the business side of things is, well, if you're earning money or you've had to close, then we'll look at the restart grants. And when it comes to halls or any other buildings that are going to be used for either of these two things, we'll be looking at making sure that you've got a good risk assessment, that you're abiding by all of the things that you should be, for example, sort of one way in, one way out, hand sanitizers, making sure that you understand the rule of 6, what your capacity can be in the building that you're using. So it's quite a full-on event, which is why we're running it for 2 hours. And because there's so much information involved, and because it's taken us quite a long time to prepare all of this information, I'm afraid that's one of the reasons that we are charging for it, but it will be worth it. We will make sure that you are so well informed by the end of this, you won't know what to do with yourselves. So registration's at 9:45, so that we can all settle in and be ready for, with cups of teas, coffees, introductions, that type of thing. Training session runs from 10 till 12. We'll do a little comfort break in the middle in case you need to go off to the loo or whatever. Let the dog out. We'll be looking at the roadmap to unlocking in 2021, and as Paul has said earlier, we've got to step 2, and we're in that at the moment. So what will that mean for halls, classes and businesses? And then when we go into 3 and 4, what will that mean? And how will these steps affect your business's activities and events? If I can have my last slide, please. So we'll also be looking at meetings, so town and parish meetings, and any, sorry about this, dog's going past. Stop it, dog's gone now. Thank you. Do apologise. So town and parish meetings and any other meetings. So if you're talking about board meetings for committees, hall meetings, that type of thing, that will be covered in that. Social distancing is also something that's really, really important and will still carry on. So, but it will change as time goes by. So we'll look at that. The good old rule of 6 comes up every time. It's a horrible little rule, but we'll make sure that you've got complete and utter clarity about that. The restart grant is really, really important for those that are restarting again. And I've also put in about operating community transport, because there are quite a few bits and pieces that people need to know about that. And I know not everybody has been operating their community transport. So again, the social distancing, rule of 6, etc., that relates to that. And then, as you can see at the bottom, there's the Eventbrite link for you to book on. And I really hope that you are able to come next week, because from those that have been to webinars here before, that we do like to cover everything in a great deal of detail. So from experience that it'll be really worth coming to. So I hope to see you all next week.
Lovely. Thank you, Jo. So hopefully that's refreshed people and given them a good perspective on what they'll need to be thinking about with reopening. We do make all of our resources available, so please do make the most of visiting our website and going to our COVID page, and you will see really clearly listed by Ray all of the different ways that you can access our support. So some of it's broken down like ACRE, NCVO, our webinars are clearly listed there, so you can find exactly what you're looking for. But if in doubt, there's always our inquiry button. You can click on that and just ask us where you can find whatever it is you're looking for, and we'll always signpost you directly to it. However well you think you've organized a website, sometimes you just can't find that one thing that you're looking for, so don't be afraid to ask. So sort of moving on now, I'm going to go to our funding update. So I'm just going to load my slides.
Loads of times, but the host is unmuting me. And no, this says the audio's on. Look. So what's happened? I don't know.
So this is where I have to kind of move the toolbar about, so bear with me so that I can read my headings. So the National Lottery have just bought out a large fund which is looking for collaborative partnership projects there is quite a lot of money in this, and it is definitely worth looking at, particularly if you are interested in doing something that is part of a collaborative partnership approach. Grants start at 150,000, so these are substantial amounts of money, but there is quite a lot that it can be used towards. It's a really flexible fund, and it would definitely be a way to build on some of the work that has been carried out by a lot of community groups during the COVID response. So it's definitely worth having a look at. Dorset Community Foundation have just launched their partnership with Made by Sport and the Clubs in Crisis Fund. That opens on the, forgive me, I've got lots of things in front of my screen, the 12th of April and closes on the 21st of May. So a fairly good amount of time to get a good grant together. Really, really good for improving access to sport, particularly for things that haven't been running during COVID that you'd like to restart and get going again. So definitely one that's worth having a look at if you're involved in any kind of sport activity. So something that's really important, and we frequently do information around stopping scams and stopping loan sharks in particular, is regular advice and guidance through our website. It's really important that we work together as a community when it comes to closing down a lot of the illegal loan shark activity. And even some of the legal activity that is carried out isn't carried out within the kind of way that most of us would expect financial guidance to be given. Recently we heard news, I'm just going to share that again.
Sorry, Paula, that was me jumping in. It seems to have had a bit of a glitch. So yeah, if you don't mind
okay.
That's all right. Sharing.
That's okay, no problem. I did wonder what I'd pressed. God forbid I'm ever anywhere near the nuclear button. As I say, we see it as very important, particularly in our communities and our very vulnerable communities. Quite a few groups recently have been fined quite considerable amounts of money, and some of the larger groups that you may have heard of actually are not operating as a result of the amount of fines that they've had. And that comes about through the great action that communities do in raising awareness and highlighting it to trading standards, to the police. So anything that we can do in our community groups to support stopping loan sharks in our communities is a really, really good thing. So if you think that's something that your community group can get involved in, this is a really good way to do that. The Hargreaves Foundation, this is particularly around education and sport for young people. Again, it's really nice. It's quite broad. It's looking at well-being. So you'd need to be able to be demonstrating that the sport and activities that you're involved in, or that your group is involved in, is actually in fostering skills for life and improving mental health, well-being. But actually, this is the kind of thing that most of us should be doing in our day-to-day operations anyway, looking at how we improve those areas for people. So it's again, really interesting one. I think we'll be seeing more and more around things like physical activity. She says, clicking on another sports fund, because it's part of the government's drive that actually recognises that not only is sport important for mental health and well-being, but actually it's been something that's stopped being a habit for a lot of people during lockdown. So one way to re-engage is to get sport back out on the agenda, and who better do it than community groups? So we will see quite a few of these fundings come up. This one's quite nice, I think, because it has a link in there to do with children in care and also special needs. So there's some real targeted opportunities, I think. Oh, and stop share. That was a real whistle-stop tour, but as we say, those slides are always available as well, and they have all the embedded links within them, so you just go straight from the slide to the funding pages. So I feel like we've torn through the agenda at quite a rapid pace, but then I always feel that on the Wednesday. I always sort of feel a little bit shell-shocked at the end of it. But thank you for bearing with us. as I said before, we will make all of the resources available. Ray works really, really hard to get the recording up as quickly as that she can, so that you've got it to access for the future. And I think all that's left for me to say is a really big thank you to Vikki Andrews and to Keith Withers for joining us today and explaining their fantastic project. And thank you to Jo, and I hope that many of you will see her next week. And on the 28th, we have our network event hosted by Julie. And the theme of that is going to be village halls and community buildings, because it is going to focus very much around supporting reopening. And we're really lucky to have Deborah Clark from ACRE who will be attending that on the 28th. So look forward to seeing as many of you at that as possible. So take care for now. Have a great rest of the day, and we will see you all very soon. Thank you very much.